because if you don't have good teeth, you might not eat enough food that you are supposed to eat. And if you don't eat enough food, you'll get really skinny.
We need to have a dentist around because so many people will start losing teeth and they'll be forced to eat like grilled cheese and soup.
I think it's important because hundreds of people out there might not have the right care and supplies to take care of their own teeth. And if they don't have that supplies, if there wasn't a dentist, then they would just have to go with not good teeth for the rest of their lives.
And eat soup for the rest of their lives.
The Willmar Dental Clinic started back in 2007. In December is when we opened our doors for the first patients to come. The hospital emergency room was seeing a lot of patients that had dental needs, and there was definitely a need for a safety net clinic or a public health clinic in the community.
It was primarily started for the underserved people in the community, and then it just kind of blew up from there and serving a lot of other communities as well.
Willmar needs this clinic in town because we have many people of various cultural groups that have come in, and they need dental care, and many are not yet capable for having insurance to help pay for dental care. So the clinic helps fill that gap.
So the clinic is associated with the University of Minnesota, and we have the students from the University of Minnesota as our dental providers. They are overseen by Dr. Walker, who is the dental director, Dr. Van Ruden, who is another dentist that works here, and I am the dental hygiene faculty. We have 6 to 7 students here at a time, and they spend 1 month with us, and then they go back to the school again.
It's really nice being on like a longer rotation, especially out here, because you really get to know the people at the clinic. You get a lot more of hands-on experience working with patients. But for our roles here, we have patients scheduled for us by the clinic management. Then we see patients throughout the day, either doing like fillings, exams, crowns, root canals, extractions. So we kind of do the hands-on work, and then we have our faculty here, Dr. Walker. She comes in, checks everything, make sure everything goes well, and yeah, it's great.
So at CentraCare Dental Clinic, we have about 10 rooms. Usually for sure 6 rooms are functioning throughout the day. Typically there'll be 4 dental students, there'll be 2 hygiene students, and sometimes we throw dental therapists in the mix.
I believe we see about 5,000 patients annually. We've brought about 750 to 800 students through the clinic who have also seen how rural health works, and that hopefully someday they will also go back and volunteer at a public health clinic to help those in need and that don't have access.
If this clinic wasn't here, I would be devastated, honestly, because with the estimates of what our kids needed, it was thousands and thousands of dollars, and honestly, I don't know what we would do, because our kiddos were in so much dental pain, and I didn't know where to go. Even when I came here, I didn't even have all their insurances and stuff figured out, and they took us here, and they just made it work.
I was getting an abscessed tooth, and it was in a lot of pain, so I wasn't eating normal. They pulled my tooth, and it felt a lot better.
I think there's lots of reasons to support this clinic here in Willmar. A, to increase access to care for patients so that they can get the adequate care that they need. Second, I think it's a great way to get students from the U who maybe aren't from Willmar or rural Minnesota to experience being in a rural place, and it really allows students to see yeah, this is how it could be working in a dental office in rural Minnesota or outside Minnesota, and maybe they would choose to go that route.
If the clinic weren't here, what would happen to many more people that I already hear is they need to go to Montevideo or the cities or somewhere else to get their dental care.
There's no offices near us other than probably an hour or more where they can seek care. The issue with the clinics that do take these state insurance plans is they're booked full. So it's very hard to get in. They're not always accepting new patients.
We make an impact every day. We save lives every day. We change lives every day. When someone comes in and they've got a lot of work to do or they're in major pain and we can take them out of that situation and they're crying tearful tears, but they're joyful tears because they know they're in a better place.
Seeing when people come here and they're not confident in themselves because of their smile and being able to correct that and see them leave happy is super awesome.
Thank you, Willmar Dental staff, for making us feel better.